Brazilian butt lift or fat transfer of the buttock. It hit the news. There was a article that came out that said it had the highest death rate in all of plastic surgery.
So
And
it's a
what
relatively more expensive procedure that doesn't last that long.
to me, it just doesn't last long enough to justify the issues. But
Cartilage cells or other things like that. That's really not legal in the US. It is legal in certain countries in the world. And that's where some horror stories have happened where
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hi, this is Dr. Roy Kim, and I'm here with Dr. Kristy Hamilton, the team behind the Beauty Scientists. And today we'll be talking about emerging and controversial procedures within plastic surgery. I think it's important to talk about because even where you know a certain brand name or certain procedure, facelift, liposuction, things that we know about, there are actually some controversial tweaks or sub procedures within that. So it's important to know. So, with Brazilian butt lift, the procedure is we essentially remove fat as fat harvest with liposuction. We've processed and filtered the fat and we place it back into the buttock, because then we can actually reshape your body, reshape your buttock, and actually help with buttock sag. But it is controversial. So why is it so controversial, Dr. Hamilton, and how do you reduce the controversy?
so we've come up with a solution for this. So Brazilian butt lift or fat transfer of the buttock, it hit the news. There was a article that came out that said it had the highest death rate in all of plastic surgery. And what that was coming from was we're injecting fat back into you that we've removed after liposuction, and there's really large veins in the buttock, particularly in and underneath the muscle. And what was happening is those veins were getting damaged and then basically acting like a little vacuum, sucking the large globules of fat into your blood circulation, which was then going to the heart and lungs. And that's not a good thing because it would clog those organs. So, what we found though is if you inject into the subcutaneous plane, meaning into the fat, not the muscle itself, it actually becomes a very, very safe procedure. So, how you know that? That's again controversial. Should you be using ultrasound to take a look at it versus just knowing your anatomic landmarks and staying away from it? We'll leave that to that's still being debated to this day in our societies. But we find if you do that, then all of a sudden the risk drops substantially. So the reason plastic surgeons initially were injecting the fat into the muscles got so much blood supply, so it's like full of blood vessels, and so that is amazing for getting survival of the fat and ideal for survival of the fat. And also, you're augmenting the gluteal muscle itself, which gives a very, very natural shape to the BBL. But we've all stopped doing that because we recognize the risk. And number one concern always is ensuring very safe result. I perform this procedure. I've never had any issues like that. And knock on wood, I never will, because I always stay in the safe plane and I avoid injecting into the area where we know those large blood vessels are.
Yes, totally agree with you. Know all about the debate. And it's a little odd as a plastic surgeon, only because you're right. They originally injected the muscle because there's great blood flow. We thought that the fat would last longer. Not true in the buttock. It's weird. It's actually true in other parts of the body. So
Mm-hmm.
there are definitely people who are injecting the pectoralis muscle, the shoulder muscles, things like that. They're actually injecting into the muscle as opposed to above the muscle. But in the buttock, you got to inject it not in the muscle, above the muscle. So
Yes.
that that's great.
And I know, and it's been a fun like element of body contouring for other areas. I guess the blood vessels and veins are just not as large, so we can safely inject the pec. But or like the deltoids or biceps, so we'll do that for men having liposuction and fat transfer for it's amazing, and it almost seems like the fat then like fuels their gym workouts afterwards. But for the buttock, we stay away. Another concept that moving from like the buttock all opposite end to the face, thread lifts. Dr. Kim, what are thread lifts? What is that? And can you describe what is intriguing about them, why people might want to do that? And then we'll go into why it might be a bad idea.
Yeah, the thread, it's a surgical thread, is made out of absorbable suture that absorbable suture material. It's not just a regular suture. It can actually have little hooks. So under local anesthesia, you glide the actual surgical thread into where you want it to be. You pull back on it, and the little hooks sort of spring back. So it actually hooks your skin underneath the skin, of course. And so you can actually place it, for example, on your cheek, And when you pull it back gently, it will pull up on your cheek. It can pull up on your jawline. People put it in their neck. You can put it in the eyebrow area. And so what it does is sort of replicating what we do with facelift surgery, but under local anesthesia and with sutures that are absorbable. It's a win-win. The problem is a couple of them. One is that you want to keep it underneath the skin. If it goes through the skin, it's called skin extrusion. Well, you have a complication. It's not going to go away. It may get infected. You have to remove it. Another issue is making sure that the actual placement of the threads are just right. You have to be very symmetric. You have to make it look artistic. Right after your thread treatment procedure, you're going to look a little wonky. You're going to look a little tight. Of course, that will go away, but sometimes it doesn't. So you, again, have to remove the thread. I think the final thing, or not the final thing, this doesn't last that long. It only lasts, they say 18 months. I'm thinking more 9 to 12 months. So it's a relatively more expensive procedure that doesn't last that long. If you get this done, let's say 4 or 5 times over like the next 5, 10 years, you might as well get a facelift. It's actually less money with longer term results and a more natural appearance. And finally, when we're doing facelift, I'm sure you've seen this, where there's residual thread behind and it has created a scar trail, which is annoying as a plastic surgeon. I don't think it's the end of the world, but I think patients may not realize that in theory it absorbs over a couple months or a year. In reality, it may not.
Yeah, and
What
it's
do you
just
think about it?
it's unpredictable, and that's the issue. And we like plastic surgeons, we like things that are reproducible and very predictable. And so the threads, like they'll say, oh, they create collagen. Well, scar is collagen,
Yeah.
which is essentially what it's causing. And so what we'll see in some patients, you just don't know if it's going to be you, is like an actual like tube or like a band of scar, and you can see it like in the brow lift or the along the cheek. And I even had a patient come in so recently, it was just like 2 or 3 weeks ago, and she was like, so like don't be mad. And I was like, why would I be mad? And she was like, I did it, because like she had this like hole in her cheek, and it was like all indented. And then they had done like a series of other procedures trying to fix it, and then she had fat atrophy after like radiofrequency microneedling done too deeply. And so it kind of just like turned into this like spiral of complications after that. So to me, it just doesn't last long enough to justify the issues. But the reason they exist is because what do patients come in? They all come in saying, as time goes on, like, I want this. And that is what it does. So in a non-surgical fashion. So I think if maybe a better material, longer lasting, or at least one that's like a little bit less inflammatory, perhaps there's still a path there. But for now, I'm not sold.
Yeah, I'm with you. And one other thing is totally different topic is extreme body modifications. So we've all seen on social media and even in some newspapers about how people get horns or they get total facial tattoos or stuff of that nature. In plastic surgery, there are plastic surgeons who do these types of procedures along with, for example, a newer trend is rib removal or rib green stick fractures to really make your waist accentuated to be quite thin.
Mhm.
I know that in theory, like we could both do it. How do you feel about some of the patients who want extreme face or body modifications?
So one thing I have to consider is like, look, there's a wide range of beauty standards. And so we don't want to make like there's not like one cookie cutter like ideal what's beautiful, right? It could be like a straighter, more athletic figure, it could be a curvier figure. There's so many different ways to be beautiful. But in my practice, I like to keep them in the realm of what's normal and could be found in nature. So that's important to me. Whether it's like lip augmentation, breast augmentation, tummy tucks, lipo contouring, I like my aesthetic is natural results. And my patients, when you're walking around, they are a representative of you if they speak about what they've done. I also just want to keep things safe and normal looking. So I will meet patients where their beauty aesthetic is because everyone's got a little different one depending in terms of what they want to look like. So as long as it's within the realm of normal, then I can be the plastic surgeon for them. Once we are going into like overly augmented looks, like overly like aggressive, then I'm probably not the best plastic surgeon for them. And since this is aesthetic surgery and not emergency or urgent, I think it's important that the patient finds the plastic surgeon that has the same vision as them. So they might need to find somebody else. But what do you do?
I'm totally in line with you in the sense that there are different standards of beauty, and I actually, on a personal level, have a certain standard of beauty. So what I consider beautiful, maybe other people don't, and what I consider extreme, other people don't. I do feel strongly that what's found in nature is beautiful, whether it's the golden arch ratio or other things or OG curve or whatever. That's what's beautiful to the human eye. And that's what's been in art for thousands of years. And that's what pretty much all humans think, regardless of culture or time, feel is beauty. So that's my aesthetic standard. I just have not had that many patients who wanted what I consider extreme beauty.
Hmm.
And to be honest, I think sometimes social media and newspapers just need eyeballs. They don't necessarily realize that the patients who want this stuff, there aren't that many patients who want this stuff. And they're certainly not walking into my office.
Yeah, I agree. And I think almost everybody asks for natural. And that's one of the concepts I try to like get through to patients is like, okay, I really need to get in your mind and understand what natural means to you, because you'd be amazed at the range of what natural looking like breast augmentation, like what that means. Some women, like they show me like breasts that like a lot of like cleavage. And I'm like, well, that's not what natural breasts outside of a push-up bra look like, but that, I mean, it's tasteful, it can be very beautiful. And if that's what they want, then certainly will do it. And other women, to them, natural really means that teardrop shape. Like they don't want to have the cleavage look, and that is more in line with a truly natural breast. But I agree with you. I think most patients are not seeking that super exaggerated look. It's rare. In fact, most of them are fearful of
Yes.
ending up looking like that. So I think that's why the website's so important. Before and afters are so important, and why I'm so appreciative when patients let me share some of their images, because when you peruse your surgeon's website, to your point of like having like your kind of aesthetic, I have my aesthetic, you should be seeing results on the website that you think also look really beautiful. Because not that you're going to get a cookie cutter exact same nose or exact same breast, but you should be able to see the vision and think that these are tasteful results, even if it's not maybe exactly what you'd want for yourself, because you're a different person, a different body.
Yes, totally agree. So, some of the newer emerging technologies, one of them is in regenerative medicine, fat grafting, and stem cells. So, as a quick background to our listeners, fat grafting is just sucking out fat and then, placing it back in. So, fat harvest of liposuction, fat grafting, we can fill it a wrinkle, we can actually augment and create volume. The interesting thing is that fat actually has some stem cells, which are technically not fat cells. Stem cells are the great grandfather, great grandmother cells that can turn into skin, cartilage, muscle, whatever, with the correct surroundings, the correct chemistry, the correct chemical hormone messengers. So, can you talk a little about how stem cells have helped change your practice, as well as some of the controversies behind it?
Yeah, so I love fat transfer, just like a beautiful operation, right? So you and I both do filler. We love filler. There's like a great place for it, but there's nothing better than replacing like with like. So if we're doing facial rejuvenation and we want to add some volume, adding your own fat's perfect. I mean, that's what we've lost slowly as time has gone on, and it comes not just with the hyaluronic, but all this other material, all these growth factors, the stem cells. And so initially it was in reconstructive patients we really saw the difference. Like we would do fat transfer into irradiated skin, cancer patients that just like they'd had surgery, they've been irradiated, the tissues were like hard and like leathery. And then after injecting fat in them, we'd find that they became softer. Some of the discoloration went away. And that kind of piqued people's curiosity, like, hey, something is going on here beyond just plumping the area with fat. And so there's an increasing body of research looking at this. And so we see it when we do fat transfer. The skin looks better. It's not just that we're volumizing and creating nice highlights and softening shadows, but it actually seems to do something to the skin and tissues itself. So I think that's what's really beautiful about it. What's controversial, I mean, to me, it's like not so controversial, but it's a stem cell. And so the moment we say stem cell, then everyone gets up in arms. And is this, we're not doing experiments on babies and test tubes with this. These are your own stem cells. They're not going to become another person. But therein lies the controversy, right? And there was some concern when you move stem cells, like could it trigger cancer, things like that. We also know that at least like in breast and face, that's not true because a lot of this research was born out of the breast reconstruction literature, which is where we're looking at patients who have already had cancer. So they're higher risk than the average person. And we saw that transferring fat from other parts of the body to the breast in areas where cancer has previously existed is safe and does not increase your risk of breast cancer. So that's really, really important.
Yeah. And then the controversy as well is even if we get your own stem cells, and we know we get it from you, we are in the US only able to wash it in saline, maybe antibiotic irrigation. That's about it. In theory, if you have the right recipe for the stem cells, hey, we can make it into heart cells or cartilage cells or other things like that. That's really not legal in the US. It is legal in certain countries in the world. And that's where some horror stories have happened where some doctor or clinic says, hey, we have a special recipe. We're going to cook it. We're going to give it to your knee. We're going to give it to your spinal cord. We're going to give it to your heart. That's where actually some documented cases of cancer have occurred. That is something that we're still working on in terms of getting the correct recipe for your stem cells so that we can actually grow cells and organs.
But but to be clear, that's not what we do when we're doing fat transfer and surgery. Like we are just taking it as it is and putting it back in just as from whence it came. But we're not doing anything as plastic surgeons right now in the US to trigger those stem cells to become something else. So whatever they do it on their own.
That's correct. That's 100% correct. We don't do anything in the US. No way. That's important for the patients out there. And don't mishear us because we're not doing it. We're doing it safely.
Yeah.
So
always safety first.
Yeah.
Another new technology that new, maybe less controversial, but really cool that you told me about was what they're doing for rhinoplasty in South Korea.
Yes, because right now, silicone implants are bigger in Asia in terms of the nose, in terms of even cheek implants, tear trough implants, and in the US, chin implants made out of silicone and other materials that are not man-made are very popular. Well, in Korea, they have the technology where they can do it in office or hospital CT scan, 3D reconstruction, and make you a custom-made implant so it fits your body perfectly. So that's amazing stuff, as opposed to opening up a box, off-the-shelf implant, and then sort of cutting it and shaping it to customize it for the patient.
And so that's an amazing option. And it's like printed, it's like perfect. It's like designed for like every nook and cranny of your own face. I mean, you cannot get that level of specificity. It's ideal. And I guess the controversial element is you are getting a CT scan, so you are getting some radiation from it, but they minimize it to the best of their ability and they're just scanning your nose. So perhaps always important point of discussion with patients, but I mean, to get like the perfect custom nose implant for a augmentation rhinoplasty, it's pretty amazing.
Yeah, I mean, that's very cool. And that's going to be popping up in the next couple of years. The company Bistool, Bistool, they're allowed to sell their off-the-shelf implants today, but they're working on getting approval from the US government for customized 3D implants, which would be awesome.
Yeah. And then back to regenerative medicine, we talked about stem cells. What about the other fun hot topic, which is exosomes?
Yeah, so as our viewers and listeners may or may not know, exosomes are little fragments of DNA. So what they do is, if you will, a little sac that can penetrate cells and deliver other fun-filled things, including DNA particles, so that the cells that they penetrate, they're delivering, if you will, a message so that certain proteins, chemicals, growth factors are released. And so this has been widely known experimentally for some time. In aesthetics, the interesting thing about exosomes is that they do work, but there are some concerns because you're actually delivering DNA. So you're delivering DNA that is not your own. We're not deriving this from your blood or fat. Rather, you're cracking open a vial and you're getting it from animals, from other humans. And weirdly enough, you want sort of like more pure exosomes, like with fewer defects in the DNA. So what that implies is we want DNA from younger animals. So in other words, we don't want cows, we want calves. We don't want humans, we want fetuses. We don't want, and you get what I'm saying here. And right now, they're legal, in other words, legal, in the US for topical use. They are not supposed to, in the US, be placed as an injection. Outside of the US, they're already doing it as an injection. So yeah, exosomes topically can help with hair regeneration. Are there any other things that you use it for?
So I like to think of the exosomes when I describe it to patients, they're like the little messengers, like tell your cells what to do. They're communicating amongst them. I view it as harnessing the power of your own tissues to just do a better job, like behave like they did when they were baby cells. When you look at little kids, children, you see like how they've got like beautiful hydration to their skin. They don't have wrinkles, like they're producing more collagen, they're producing more hyaluronic acid. So you're basically the goal is to have the exosomes target specific concerns, whether it's pigmentation, collagen loss, and say, hey, produce more collagen, produce more elastin, turn over the skin cells so you can reduce your pigment, repair yourself. So that's where we're headed with the technology. And these are the early days, right? Right now we just want to see that they are safe and providing a benefit, but I could see it getting to a point where it's like a specific exosome treatment that is going to like target collagen production, going to target elastin production, going to support hair growth. Is what I predict where we'll go with this technology. So targeted messaging to the skin cells to do specifically what we're looking for, as opposed to right now, we're just like overall health of the skin, overall improvement in its appearance and well-being.
Yes. So yeah, globally it's like, okay, we can put it on the skin and it's going to help it. We're not really targeting, are we improving skin color, skin thickness, the wrinkles, all those good things, along with hair regeneration. It'll be interesting to see how exosomes are increasingly used in the US and whether we're allowed to actually inject it or not.
Yes.
So one of the other fun, yes, one of the other fun topics, which the nerdy name is PDRN, polydeoxide ribonucleotide. You may have heard about this as skin booster derived from salmon sperm DNA. So right now, it definitely is legal outside of the US. The company that makes it actually has a topical over-the-counter lotion that is actually allowed to be sold in the US. But the interesting thing is it definitely seems to work. However, it has to be injected. Now, my understanding is that it is not legal in the US yet. What are some of the benefits of the salmon sperm DNA skin booster along with the legality?
So we see it. So it first came to my attention from you actually, and then shortly thereafter, you were ahead of TikTok. I have to say, Dr. Kim, you told me about it before, getting popular, and it's in pursuit of this glass skin appearance. So it makes sense that it came out of South Korea, but the goal is to give this beautiful, shiny, poreless look. And again, it's a regenerative medicine concept. And I think you can actually speak to it more because you've witnessed these treatments or talked to individuals who actually perform it. Is that correct?
Yes. So it's similar to skin booster Skin Vive made by Allergan, which is a different chemical, but same idea. The salmon sperm DNA extract are injected right underneath the skin surface, like literally right underneath, like 2-3 millimeters. And then this type of chemical actually helps skin to regenerate. Specifically, it regenerates collagen. It increases the skin elasticity. It actually helps with the evening out skin tones. And the interesting thing is it was actually first researched in regenerative wound healing. Nobody thinks that if you inject HA filler or what we use as fillers in the US currently, if you stick it into an open wound or diabetic ulcer or whatever, it's going to actually regenerate tissue. It doesn't. But this stuff, PDRN, salmon sperm DNA, actually does regenerate tissue. So if it's injected aesthetically, it will actually still regenerate collagen and other types of tissue. This is very exciting. I think the issue is that it has to be injected, and right now in the U.S., we're not allowed to do it.
Right. And as always, we're a little bit behind always on what is done internationally. And I know it's with the FDA trying to keep us all safe. But oftentimes we find that things get pushed through on the reconstructive end a little bit faster. So if they can demonstrate it's safe in wounds, then you can extrapolate that it's safe in intact skin itself. So all very exciting. And I know Jennifer Aniston put that one on the map, and she's been looking quite radiant lately. So hopefully it's coming sooner. We'll have to go to South Korea to try it.
Yeah, I mean, I know that you can find people who are willing to inject it in the US, but I know that they're getting product, it's not FDA approved, and they're injecting it. And my concern is that, even though there's a lot of research that's been done, it's still, I mean, in the US, we're not supposed to inject it. The company's called Regeron, Rejuran. They have a website that's US based and you can buy lotions, but they don't sell to anybody the injectable type of Regeron that's available outside. So
Mhm.
we may have to make a field trip to Seoul, South Korea.
This is on my plan of things to do. I love this idea. And then we, as plastic surgeons, we do, and just physicians, we do things off label all the time. But whenever things come with stem cells, whatnot, we just have to be a little bit more careful because we want to maintain our licenses and be able to take great care of our patients. So we'll be patient.
Yeah. Well, certainly there are some safety concerns, some ethical concerns about these controversial topics. And I hope Dr. Hamilton and I have really gone over some of these are safe, some of it's hyped. I think some of it's overhyped, and some of it, you know, it works, but it's just not available in the United States yet. Are there any other things you wanted to talk about, in terms of safety and ethics?
I think the most important thing is just to have a candid conversation with your plastic surgeon. Make sure you understand the relative risks and benefits. All board certified doctors will do that with you anyways. That way you can make an informed decision about what's best for you.
Totally agree. Patient safety is always paramount because you want to have beautiful results, but we have to be safe doing it. So on that note, stay beautiful as always and stay safe while you're staying beautiful.
Yes, stay safe and beautiful.
That's right.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.